Before I begin, I'd like you to sit down, rest your hands in your lap, and bring your attention to your breath. Notice the sensation of your breath. Maybe it's cool air entering your nose or the rise and fall of your chest or belly. And invite your breath to lengthen, perhaps to a count of 5, inhaling deep into your belly. Inhaling to a count of 1, 2, 3, 4, 5, and exhaling 5, 4, 3, 2, 1. Again, 1, 2, 3, 4, 5, and out. 5, 4, 3, 2, 1. Last time. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. Let your breathing return to normal and open your eyes if they happen to be closed. Now, I must confess, there's a reason I began that way. I'm going to be talking about the stress response and your nervous system, about how being stressed out can affect your physical and mental health, your ability to relate to others, and to listen. You'll learn how the breathing exercise I just asked you to do increase the chance that you'll pay attention to me and retain what I'm going to talk about. I'm Dr. Ann Seide, an integrative medicine doctor in Southern California. In addition to seeing patients, I also work with groups of incarcerated people, police officers, and fellow healthcare providers, teaching them how mind-body practices can affect our health. A healthy nervous system rapidly responds to threats, like jumping out of the way of an oncoming car or anticipating a dangerous or violent situation, followed by a quick return to being relaxed and ready. But today's world tends to be one where there's constant stressors, things that lead our sympathetic system to turn on and stay on, overriding our parasympathetic system constantly. This leads to chronically elevated levels of adrenaline and cortisol, which then leads to a whole host of other health problems like diabetes, heart disease, dementia, autoimmune diseases, and susceptibility to infection. You can try to turn off the sympathetic drivers. You could spend less time obsessively watching the news. You can eat a healthy diet. You can avoid contact with toxic people or situations. Or you can learn to augment your parasympathetic tone. Again, a healthy diet helps, a meditation practice, yoga, and breathing exercises like the one that we started with. I've had patients who were actually able to lower their systolic blood pressure by 10 points simply by breathing like you did, inhaling and exhaling to a count of 5. Remember the way this parasympathetic system is described as rest, digest, and discern. We know that a very turned-on stress response leads to tunnel vision and a decreased ability to take in new information. Teachers know this. Kids who are stressed out at home can't calm themselves, and they have trouble learning. And first responders' heart rates soar when they're called to a potentially tragic scene, and they find it difficult to perceive external stimuli outside the violence they've witnessed. When we began, the invitation to breathe slower caused your vagus nerve to sense this slower breath and take that information to your brain, leading to enhanced parasympathetic tone, so your heart rate lowered, your blood pressure dropped, and your eyes became more focused. You were more likely to pay attention and take in the information that was about to follow. When it comes to these messages from our internal organs to our brain, the one that gets put front of the line is always the one that's from our lungs. Breathing and the things that affect it get our attention faster than anything else. So if you want to trigger the relaxation response, using your breath is the fastest way. The better you become at recognizing your own physiologic responses, the sooner you can intentionally engage in practices like the 5-count breathing that will modulate your own stress response, make you healthier, and also have an impact on those around you. Because if you can bring a healthier response into any situation, you're going to cause others to do the same. Thanks for joining me today. I hope you found this brief science lesson interesting. Even more, I hope you find the breathing exercises to be helpful. I wish you good health.